Hi, I'm Teresa, your veterinary technician at Sheridan Animal Hospital. Your pet has been given general anesthesia with major surgery and will require extended time for recovery and healing. I want to go over post-surgical care with you to ensure that both you and your pet will make it through recovery time with the least amount of discomfort possible. Your pet may act abnormal tonight. They may be sleepier than normal, slightly nauseous, they may vocalize or even act uncomfortable. These are not uncommon signs for the first night after surgery. The doctor advises waiting until 7 p.m. the night of surgery, then offer your pet about a quarter of their normal diet and water, unless you are told otherwise. As long as your pet does okay tonight, starting tomorrow morning, you can go back to their regular diet. Addressing pain and inflammation is very important. Your pet was given a non-steroidal anti-inflammatory drug known as an NSAID at the time of surgery today. It will last for the first 24 hours post-surgery. You will be starting oral pain and inflammation medication tomorrow morning. These are generally given for the first 3 to 7 days following surgery, sometimes longer. Even if your pet doesn't seem uncomfortable, remember that the medication also helps with inflammation post-surgery and is always necessary. Please give the pain and inflammation medication as prescribed. If your pet still seems uncomfortable and you think more medication is needed, please call the office. The next thing I want to talk about is very important. Your pet has been fitted with an e-collar or a medical shirt to wear for the next 14 days. This is very important for your pet's quick recovery. These protection devices need to be left on your pet at all times for the next 14 days unless you are directed otherwise. Your pet will be able to eat, drink, and sleep with this device on. Both devices are used to protect your pet from unknowingly causing self-harm. Taking off these protections and stepping away for even just a moment, leaving your pet unattended, can be very dangerous, even life-threatening. In that short amount of time, a pet can chew open their incision, causing a need for emergency surgical repair. I know these methods can be cumbersome and bother you and your pet. However, they greatly aid in quicker healing of your pet. Your pet's incision needs to be kept clean and dry for the next 14 days. Do not allow your pet to lick, chew, rub, or scratch at their incision. This can cause the incision to open and or become infected, thereby extending the healing period. Do not apply any creams or ointments unless otherwise directed. Monitoring your pet's incision daily is necessary. Please check for redness, swelling, discharge, or odor. If you notice any of these signs, please contact the office immediately to schedule an appointment for the doctor to examine the incision. Your dog can only go outside on a handheld leash to use the bathroom and then return to the house for rest. Allowing your pet outside off leash can lead to them running or chasing something and opening their incision, thereby causing the need for emergency surgical repair. Not only is this dangerous for your pet, but also costly. Cats need to be kept indoors at all times for the next 14 days. To minimize the chances of infection, your pet cannot have a bath or go swimming for 2 weeks following surgery. If your pet gets dirty, it is acceptable to use a damp washcloth to spot clean areas of the body. Do not wash over the incision site. In most cases, not all, your pet's incision was closed with surgical glue and will not need to have sutures removed. However, if you see sutures or staples in the skin, These will likely need to be removed. Generally, this is done 14 days from the time of the surgery. If suture removal is needed, an appointment will be scheduled before you leave the office today. Causes for concern. The incision appears open or has a gap where surgery should be. Your pet is lethargic for more than 24 hours. Your pet vomits after the first 24 hours from surgery. Your pet experiences lack or loss of appetite. You see redness, swelling, or discharge from the surgical site. You see bleeding from the surgical site. There is an odor from the surgical site. The surgical site is hot or painful to the touch. If any of these occur, please call the office. If you have any questions for the technician or doctor, please do not hesitate to ask. If you have concerns once you arrive home with your pet, please call our office at 989-291-3647. Thank you so much for trusting Sheridan Animal Hospital with the care of your pet.